Mm.
All right. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Ahlan wa sahlan. Welcome everybody to Enriching Talks with me, Hafsa. Today is episode number 19. And you see, today's episode has a big fat special saying on it because it is a special episode. First of all, my guest is very special. Secondly, this week is the World Breastfeeding Week. So it's all breastfeeding atmosphere around us. And this year's theme, so every year they have a theme. This year's theme is all about sustaining and strengthening what works. So I could not think of a better guest to have today. And secondly, I'm glad that she's here. So I'm going to introduce her in a bit. But before we kind of go there, I just want to introduce myself for anyone new who's joining us today or anyone who's listening to this right now. My name is Hafsa Qureshey, and I am working with mamas and babas and parents from pregnancy, labor, birth, breastfeeding, and beyond, alhamdulillah. This is my passion, and I started these enriching talks, and we are on episode 19. The rest of them, you can find them all on my YouTube, which I will share in the WhatsApp group afterwards, on different topics, entertaining parents and breastfeeding and pregnancy and birth. And that is my mission and vision, to provide something free online, an interesting talk with a special guest to give you inspiration, to share birth stories, some motivation, give some support, laugh together, educate together, empower each other, and much more. So I just love doing this, and I try to find things and topics that interest people. So after we finish, I will be sending a feedback form in the groups where you can tell me what you need in future so I can try and arrange such a talk. Without further ado, I am going to go ahead and introduce our beautiful, beautiful guest. But before I get to her technical stuff, let me just say she is a very dear friend. I would not be wrong if I said she is one of my best friends. Alhamdulillah, I'm to have her as a friend. And then, when it's two friends online trying to be professional, you can expect some little informal moments together between us. I think this makes this even special. And I think if I look of it, Miriam and I, we met, I think, more than 10 years ago. And we met at something we did together on breastfeeding. So she did the training, I was there. And it's we've been through so much. And I think it's just brought us closer. Those of you that have taken birth classes, the example I always say, that a friend of mine and I had our babies kind of back to back, and then how every baby develops differently after coming in this world. Similarly, every baby is developing differently in vitro. This is that friend. So you a story for someone who people kind of know beforehand. Um, so today is going to be about talking about beyond the latch, which is something maybe you'd be like, okay, I mean, we thought breastfeeding khalas, but there is something much more deeper. We'll explore about oral restrictions and how that can impact function, and holistic approaches. And honestly, Miriam, like, I love you, you're an amazing friend, but you are also someone I hugely look up to, like a dear mentor, someone I've learned from, and I'm constantly learning from as well, alhamdulillah. So this is all her academic background. I mean, I'll leave it on the screen for you guys to read. Mashallah, she's got her, mashallah, master's and in nutrition, holistic nutrition, breastfeeding, um, childbirth educator, doula training, and diabetes specialization, lactation, IBCLC. She's a lactation consultant. And best of all, she is someone who went ahead and specialized in oral ties, tongue ties, how that impacts the baby, holistic breastfeeding, and everything to do with body work and so much more. So I just feel like, mashallah, yani, in my experience and people I know, she's one of the best person who can talk about this topic, if not more. All right. And this is, of course, her professional background. Guys can read it on the screen. I love the last thing she wrote. MashaAllah, Allahumma barik. She's a mother of 5. And where she says motherhood is the secret to superpowers, I say yes to that. So she indeed has superpowers, which I'm sure motherhood taught her, is all of us. So Maryam, ahlan wa sahlan.
Oh my God, Hafsa, thank you so much. That is a beautiful introduction. I don't deserve it. I'm so like, oh my God, thank you. I think the best of it all is you being my friend. honestly, life is so hard without friends. Life is so hard without something you're holding your hand and like, okay, we can do this. Let's do this together. I mean, venting is a therapy. I like totally believe in this. And I cannot imagine going through all of this. Oh my God, it's already 10 years. It seems like we just met the day before yesterday. Mashallah. I can't believe it. But those 10 years were full of like ups and downs. And Alhamdulillah, we're just taking the highlights and moving forward, inshallah. So thank you so much, Hafsa. If anything is, I could never done this without like the support of my good friends, the belief in the mission, the passion. And I think me and Hafsa both comes of a very academic mainstream background,
Yeah.
and like trying to move into seeing this from another perspective, the holistic view of things, the believing on that there is much more than we think is there was like a tough journey to go through. And between my deliveries and her deliveries, I think we cover all that is there, right? Everything. I think twins we don't have, right?
That's the only thing.
But everything else,
Yeah.
yes, like all the issues I think we went through. Twins we don't have, yes. Everything else like is the check mark over there.
Yep.
Thank you so much.
So, what inspired you specifically to specialize in oral restrictions and this holistic approach? I know, I mean, I think I'm probably asking a question you'd be like, Madri, I probably just did it, you know?
Yeah.
What inspired you so much into VBACs? Well, it's my story, but I'd love to know yours.
Yeah. So I honestly did not have any problems with my kids breastfeeding them. It was like no restriction, nothing. But like, I do believe the more you know, the more you study, the more you know how much you don't know. I mean, if you met a person specialized and he tells you, I know it all, that person knows nothing. This is like a deal breaker to me. If he thinks that he knows everything, if he thinks he or she that they have the answer to it all, then rest assured that this person is all over the place. They know nothing. Because honestly, life is a mystery. And every one of us is writing his own story, especially with breastfeeding and babies. Everyone is different.
Beautiful.
So coming to this, I believe, like as I start meeting with moms, and every mom comes with her own story. So looking at it as it's her or like their as a family, their unique thing, like inspires me to learn more. So it's not a mom and a baby and a milk. It's way beyond this. And honestly, like I think we underestimate this whole journey and thinking there is 1 + 1 = 2. It's not. There's always much more. And like what I mean, you all know, or I don't know if you know or not, like we started, or like a lot of the breastfeeding issues happens online, like through WhatsApp. People send you their problem through WhatsApp, or like what you read through like the Instagram and the web pages and Facebook. I don't know, your audience are young. They're not Facebook material, right? They're more Instagram and TikTok.
I'm the Facebook.
Maybe. Okay. So through social media in general. And when you read those topics and when you read those posts and when you read those questions, you only think that it's a straightforward, but it's not. There is much more. It's not like my baby is not latching. Oh, then do this. Or like, for example, my baby is not getting enough milk. Oh, then do this. Or like, there is a tie. Let's release the tie. It's always much more than this. There's a why. There's what happened. There's like, let's pause and let's look at you as a person. Why do you think you need help? Maybe you don't. Maybe someone put this question in your head where there's nothing wrong at all. And I do really believe there's a curse of knowledge when you know so much, when you have reach of so much.
Yes.
It just make you question much more, or like make you think there's there must be a problem with me, or like there must be something wrong that I need to look for, or something I need to fix. No, no. You are your own. If you're happy, if you're good, if everything looks okay, don't worry about anything else. I know I drifted about what I want to say. The reason I look into ties because sometimes everything looks okay, but there's still uncertainty or unhappiness or a mom who does not feel okay. It looks okay. It sounds okay. And instead of doubting the mom, I started believing that there is more. And it happened with like one of my close friends. And you were there, Dan Al Hassan was there, Fatuma Bujarwa was there. So a lot of them had a baby like closer age to each other. And like and there those are people who knows or like supposedly knows, but there's something missing in the equation. And like I started looking into things and I was shocked that tongue tie was there since 1816. Can you imagine how very, very old that concept was there? Since 1816. You can find it in the old book. There was something called tongue tie. Midwives used to grow their nails so they can snip the tongue as the minute the baby was born. So it was there. When people start being more modern and thinking that they don't really need the breast milk, the formula came in, the teats came in, the nipples came in, then there is another solution to overcome the challenge. So the tongue tie was always looked at as a challenge that the mom can face. The solution is to release it. I mean, there was a problem. The solution was to release it. But now there's another solution. Let's just give the baby formula. Or let's just give the baby something else. Or let's just, I don't know, feed the baby at 3 months, which what happened in World War II. They think that, okay, there are not enough milk, moms are struggling, moms are working, mom, whatever. Okay, let's introduce food early. So another solution overcoming the main problem. So it was there. We overcome it with like thinking that we know more. But again, the more we know how much we don't know.
Sure.
And when I start digging into like, okay, what could be the problem and what can like be the issue with moms not feeling 100% sure that something is wrong. And honestly, moms are never wrong. Moms are never wrong. They know when something is not working right. They can doubt. I mean, it's their right, but they can feel and know when there's something is not right. And when there's something is not right, it's my job to believe them. I mean, who am I? I'm just like a person who's like just coming around in their journey. It's their journey, it's their chapters, their story. I'm there to help a little bit or like to guide a little bit or like, maybe tap a little bit or like cheer up. And they're going to do the whole work. They're doing all the hard work. So just for me to learn on how to give the right answer. And I like having the answers. And the more I dig, the more I know I don't have the answers. Which like, yes, I wish I know. I mean, honestly, there's so many times which I wish things are like, yeah, that's it. Just do this. It's never is. It's so complicated.
I mean,
so yeah. I mean, life is complicated, honestly. But I mean, what is more beautiful in life than having a baby and caring for it and for me to be part of like trying to ease this complicated that comes with it. It's a beautiful thing. And like I keep praying that Allah subhanahu wa ta'ala will guide us on the right way. So yes, it helps digging more and knowing more, but again, it raises so many more questions.
I love it.
Or like why or how. I think how is the right question.
But mashallah, I mean, I really feel you found a true passion in this because like you said, I mean, you and I, we've done so many different certifications and things and stuff. Like you said, I just love what you said here. And I would just want to reiterate it that trust when what the mother is saying. And this is, I think, the empathy and just connecting with the mother and knowing that if she's saying something, there is something, and just looking deeper into it. And this is where I think I just love our title, Beyond the Latch. It's not just what we see, it is what the mother is feeling and what is happening. There is lots of behind the scenes of breastfeeding, which are not me. I wasn't even like, are they even there in the book, Madri? I don't know. Like, like with Halima's breastfeeding journey, I would say I faced تقريبا every single issue in the book. But this oral restriction and stuff, I probably overlooked there. Maybe that was there as well, you know? So
Absolutely.
yeah, I think this is where what you said, that some breastfeeding challenges can continue even if the latch is there, right? And I'm just so shocked by the number 1816 because I just feel tongue ties and lip ties, and now I learned from you buckle ties. This is there everywhere now. Is it something that is some sort of evolution happening in like the oral structure of children? Or is it something that we are better in recognizing now? What do you think? What is your observation?
I really love the question. So, if we look at the human structure or the human anatomy or the way that we look, if you take the skulls of humans or babies, from like centuries ago and now comparing them together, you can notice a difference. People used to have like a very wide, broad jaws. The structure of the face was broader, and we have like kind of symmetry between the nose and the lower chin. Okay, so the structure of our mouth looks different before. The reason of that, we ate differently, we moved differently. So people used to eat the differences types of food. It comes to if I'm not mistaken, something between 600 and 1,000. Now, if you count the diversity of food that we eat, it's around 2025. So can you imagine the differences, the number differences? Although people used to starve before, right? But there were variety, there were different structure, okay? Now we don't want to hurt our teeth. We don't want to chew. We want something smooth. I mean, we start with babies like mushing things down, which we don't necessarily need, thinking that this is what they need. But actually, they're ready to chew. They're ready to bite. They're ready to move, which brings me to the other part, movement. We don't move as much. And movement is life, especially for babies. There's something called, or maybe I called it, or maybe we called it, the love disease. We love babies so much. We cuddle them, we wrap them, we honestly imprison them so they don't move. We're just so worried something will happen to them. They were like shake, they were startled, they will move their hands. Oh my God, they scratch their cheeks. The hand wake them up when they're sleeping. They need to move. We wrap the baby, bundle them. I know your word is warag we warag the baby, which is the vine leaf, in a way that really we don't want them to breathe, but that restrict their movements. And in that very special beginning of months, where they're so sweet and nice and like soft, the movement can help starting from there. So it's not just about the muscle, it's about something called fascia, which is now coming more and more to the surface. Fascia is a very soft tissue that covers all the muscles in the body, covers all the parts. And the more you strict the body, the tighter the fascia will become. The tighter the fascia will become, everything will be stricted in place. So to answer back to your question, when the baby's inside the mom's womb, it's tight. It's so like, oh my God, faqsa. It's so tight. Like there's no place for the baby to move. But when the baby comes out, so the fascia is structured in a certain way. So when the baby come out and the fascia or the muscles or all the baby is trying to stretch, we're so terrified. We keep soothing and like covering and bundling the baby. Those tissues becomes tighter and the baby become more stiff and the babies will be harder to move. And then again, when it's come to like, for example, for crawling or sitting or eating or like even sucking, things are just harder to move and get along. So because we love them, we're terrified. There is less movement. Our environment is different. So we eat differently. Our whole like structure of the body comes differently. There is a lot of supplements, that are being introduced for the mom. And like doctors believe that they're like super important, for example, folic acid to prevent some kind of diseases or some kind of degeneration that may happen for the baby. But the way those are built or they are made kind of lower down the normal metabolism that happens for the baby. So when it's lower down, the body will think, the body of the baby think that there's something wrong. Okay. So they go tighter and they go trying to protect the baby more. So the gene that is responsible for the orals, like the tongue, the lip, upper lip, lower lip, the puckles, or the cheeks, goes, oh my God, I cannot be releasing the tissues much more because I think there's something that is not working right. So it goes tighter. So it shows more tightness. And when the baby comes out with a lot of the information with people around him, hold the baby right, put the baby right, do this, do this, and do this, and do this, and do this, just things becomes more tighter. Um, uh, I'm not saying don't listen to your doctor. I mean, me and you can talk about this forever and ever. There are better alternatives. There are always better alternatives for like the health seeking that we want to. Knowledge is there. I mean, this is point 3. Knowledge is there. People do know more, but yes, people know more. So we think it's coming out more, but it was always there. The difference is that we are talking about it more. Still, if you go out now and talk about puckle tie, a lot of like professional and even like people who are involved will say, what? So it's not out there yet, but it's there. And I think the mother knowledge is the key into all of those things. So I just finished doing a systematic review of mothers' experiences when releasing a tongue tie. And one of the major points that came out that the healthcare practitioner do not believe the moms.
Oh, wow.
Because they do have what they think and it's there and it's the protocol and like, okay, this is the way I have to diagnose. But looking at it from like a mother perspective and a breastfeeding professional perspective is totally different. So we need to meet in the middle to translate what was already there into what we need to do now. So yeah, it seems that it's much more, but there's still not a single protocol that diagnoses it right. Professionals do not agree on the way we diagnose. So to say it's more, like based on what? Who said it's more? Because we think it's there, or because someone actually professionally diagnosed it? Or like there's a study, there's a number, I mean, it's easier to say, oh, I think the baby has a tie, but tie is not a thing that goes in there and removed from there. It's a whole body system. It's a whole function. It's a whole, a human and a mom and a lot of things can go there. So it's not, it's there or it's not there. It's how are we dealing with it? I mean, I'm sorry, Hafsa, I know I can talk about this forever, but it's
I'm loving it.
It doesn't matter if it's there or not. What matters is what are we doing about it? Are the mom and the baby having a better life or a better experience from whatever they're having? And like again, from that study, the systematic review I did, a lot of the moms feel so relieved the minute someone reassured them that what they feel is right, whether it's a tie or it's a restriction or it's like just changing it position or like something that need to be fixed.
And I agree with that. I think it's similar to birth work as well. Like, the mother's instinct matters so much. And I just feel the fact that we have more awareness, the more like we are listening to it more. And I'm very interested with this. You've left me with a point to ponder. Who is saying, like, where is the diagnosis coming from, right? What are we classifying as diagnosis based on what? Yep. I think it's like you said, we can talk about it. There is so much back and forth, like you and I, we have these discussions all the time. Like we're discussing, it could be that, it could be that. We're trying things that work. And then ultimately it is just making sure that at the end of the thing, the relationship, the dyad basically between the mother and the baby is functioning fine. So that brings to the impact.
I just want to add this, if you don't mind, Hafsa. So a lot of times, more than I can count, the mom will come and say, the doctor told me that the baby does not have a tie. Okay. And I don't want to tell the mom, I don't want to underestimate the doctor. I mean, we're live, we're recording. I don't want to say it's some bad word, but like, we don't want to, I like, with all respect, I honestly do respect professional, but I respect more people who will say that they don't know about this, So there is much more like into diagnosing the tie than what the average pediatrician will know, the average surgeon will know, the average ENT will know, and the average dentist will know. Those are the people who are like more. We don't have midwives for now in Kuwait. Midwives would probably know, nurses should know, inshallah. So like there is much more than the average professional know. If you are not educated specifically in Thai, you wouldn't know. Even breastfeeding consultant, if they're not like directly taught or like, they worked on themselves to know what do we mean by tie, they cannot tell you the baby has tie or doesn't have a tie. So diagnosis is not a yes or no, it's not a tick or not. It's a whole like very long list of steps to say that yes, the baby has tie or not. So if you are a mom and you're listening to this and you think something's wrong, there's something's not working, and you're not looking into ties because a doctor or a professional or someone told you he does not have a tie, then maybe that's not the right answer. And you know what amazed me now? And because mom has a tie with one of her babies, now she thinks she knows it all, which I do respect. I know moms sometimes know more than the professional, but there's like more to it than what happened with one of your babies.
Yes, of course. Exactly. Every child is going through the different case as well.
So just to finish this point, there are professional diagnosis tools. They are available there. They're like, I think 4, 5, maybe 6. Like one of them depends on the picture, one of them depending on the measurement, one of them to tell how severe the tie is or like what level of tie is there. There is like, this is the presence of the tie or not. But to tell the baby has a tie or not, it's not just the presence of it, it's the function of it. So I did have a mom last week, 2 moms actually. One of them, the baby has a tie to the tip of the tongue. Like it's an obvious tie. Like it's like, depends on the category. We can call it level 4, which is all the way to the tip. The baby's doing fine. He's gaining. There is no pain, just fine. And 2 days after, I had a baby who like no tie whatsoever. The tongue is just like, you can stretch the tongue all the way up. You can see any tether, no tissue, nothing. And the baby's acting like it's level 4. All the stretch mark, painful latch, not gaining weight. It's like, so it's not about it's there or not, which we think the diagnosis will give us. It's about it's there or not and what function it's doing, how it's affecting the whole breastfeeding process.
It's not the presence of it. It's not a yes or no. It's rather how what is it in the body that is impacting the baby. Wow, amazing. The function.
Yes.
Right.
Yeah, absolutely.
Not always like, because a painful latch or breastfeeding painful session, it's not only because of a tongue tie or a bad latch. It could be so much more.
Absolutely.
So how would
absolutely
you recommend for a parent who feels like that they're struggling with breastfeeding, something's not okay? What sort of like, where would you take them when it comes to that this needs further assessment? They've seen a lactation professional, like general, someone like me, for example. They've seen a pediatrician, etc. What would you notice in a baby that would help you? Like you would be like, you know what, this baby needs more body work, for example. And what is body work?
Okay, so I'll go to the first part of your question before I move to the second part. So when the couple or mom or the dyad feels that there's something not okay, seek help. Definitely seek personal help, because what's on the social media is very public, very generic, very open, and it's not always true, and it's not always you.
This.
So I will definitely ask you to make it personal. Definitely make it personal. And like, even if you think it's so simple or sorry, stupid, or it doesn't make any sense, or like, oh, no, but I read this doing this, but I read, it's okay. Make it about you. And there are so many like resources that you can offer it for free. I know Birth Kuwait can offer like free consultation, or like you can go and find all those amazing people who can like offer you an online consultation that is all about you. So make it about you. It's not one size fit all. That's for sure. Okay. That is one. Two, when you think there's something that is not okay, or even if you ask someone and you think it didn't just satisfy you, the answer, right? I would look at it into two ways. Either you go for someone specialized. There are so many people who are specialized in tongue tie, and when they tell you I'm specialized in tongue tie, I will just like humbly tell you to ask for the references. From where did they get the tongue tie? Because recently, because tongue tie is so trendy, there are people who claim they know about tongue tie and they honestly know nothing. Okay. So just simply ask for the references. That's one. Two, there's another part. I don't know how to say this nicely, and I think I need your help on this, Hafsa. It's okay to doubt. It's okay to feel you're not sure. And it's okay to ask for emotional support or emotional help. And that's a huge part as well. Okay. So if you think there is something not okay, but the baby's happy, the baby's gaining, like he's developing to the milestone, he's changing sizes, he's have this like stretch moment of like doing and interacting and moving, and you still don't feel okay, it's probably, or it could be, or maybe like with whatever, it's okay to ask for an emotional support. I mean, especially if the delivery wasn't what you hoped for, or if something, you want to elaborate on this point, I think you can. I'm tiptoeing around it. Just go for a therapist if you think you need to, right? And that's okay. That's absolutely okay. I mean, us as a professional, and Hafsa knows this, God, it's like, it's so much hard when you came out of the experience knowing that it should be this way, or someone told you it should be this way. It doesn't have to be this way, but this is what you read, or this is what you were taught, or this is what people frame how, like, oh my God, the amazing word of like delivery and breastfeeding should be like. And you stayed 19 hours and then you end up having C-section and you end up, I don't know, whatever. So yeah, it's okay. You need professional support. Moms Group are amazing.
Yay.
And yes, please, Hafsa, if you want to elaborate on this.
Okay, yeah, it's okay. It's nice to find someone you can relate to. So the support groups would give you some relation. It could give you the empathy. It could give you just like some hearing out. But yes, seeking that professional support where and when needed is important. The emotional part, I'm not defying that. That is there, and that is very important. And I think I started and you started, we started our journeys as breastfeeding counselors. So it was more about counseling a mother with our counseling skill than rather than solving the actual problem. Usually, sometimes just hearing it out, right? But sometimes, again, like you said, it can be much deeper. It can be a painted picture, but that's the surface. We need to scratch that off, and there is something so much more, so many layers beneath it. And it's not just what's happening in the moment. Your pregnancy, any traumas you experience there, the birth itself, any traumas that happen there, all of this it's all like interlinked, and one thing can lead to another, right? Just like we say, avoid simple medical interventions like IV drips, because that can influence your immediate breastfeeding journey, right? If there was any takhdir used, like any kind of analgesics and anesthesias used, that has a direct impact on the immediate breastfeeding. So there are so many things that have this interlinked thing. So yeah, don't suffer in silence is my first thing that I would say. And seeking the right professional support is the second thing. And this is where, like I say, there are times where I'm like, you know what? I pick up my phone, I'm like, Maryam, this is something, I feel something's off there, right? And we both kind of discuss into it and we realize, okay, this is probably what kind of support she needs, and then guiding her in there. So there's nothing wrong in having to branch it out where we feel it's needed.
Absolutely. 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 And thank you, Fakiha, about your comment. My first advice to the moms I see in the clinic is like, please, please stop following the influencer's mom. Please.
Yes, thank you.
That is my first advice. Like, do not follow them. Do not. Whatever advices they're giving, whatever, like, oh my God, I love. No, no. It's like, oh my God, it's sending messages to you that you don't really need. Just focus on yourself, focus on your baby, focus on your journey, do it your own way, and ask professional help or like the
Well,
right help when needed.
this was a really huge thing because I started following a group, like I'm not gonna say the name, and when you see freezers full of expressed milk,
Yeah,
and it affected me, Maryam, like when I was expecting
of
everything
course.
affected me because that is where I was struggling. And then I'm seeing this and you don't realize it. You wish for something, but so please, yeah, protect your mental peace. That's number one step. Yeah, like I say that, like when I teach my birth classes, أول شيء debrief from trauma, emotional preparation. Same thing when it comes to your lactation journey. Don't let anything, like our emotional health has a direct effect on so many factors where we don't even realize.
Absolutely. Absolutely.
And I
You're
think
absolutely
that
right.
brings us to like this is the actual holistic approach. I think I feel the word holistic is thrown around a bit too much with where it shouldn't be, and understanding what exactly is holistic approach, right? And this is the whole thing that Maryam just talked about in the for the last, I don't know how long it's been, is exactly what holistic approach looks like, right? This is where you are not going by the book and not one size fits all. You're looking at an individual case, right? And even if
Yeah,
the same mother, inshallah, she has 7, 8 kids, her every child's journey is going to be different.
absolutely.
I think,
You are absolutely right. Yeah, of course.
yeah,
Of course. And like I think it's harder comparing your kid to your previous kid than comparing your kid to your like social media kid, you know? Because I did it before. What happened now, you know? And sometimes it's easier. I mean, if you want to talk about the anatomy, for example, or physiology, with every pregnancy, your body is like developed differently, right? Or like, you know, your breast is there, is ready to produce milk and maybe have like even more, like, you know, lactation glands and like ready to prepare more milk and stuff. But that same body is going through everyday stressor, life, pollution, I mean, trauma, I mean, war, God forbid, we don't know what happened. And all of this is registers in the body. The body doesn't forget, the body stores things. So, yeah, it could be easier, but again, it could be different and it could be harder and it could be you asking for help.
true. SubhanAllah. I think this,
Yeah, yeah, you're posing. That's why I stopped.
yeah,
You're asking for help for like that does not make you a lesser of a mom, or that does not make you you don't know you're old, you don't know how to do things, or no, it's not like that. It's just different.
yeah. So that brings me
Yes.
that I want to ask because I feel this is something that I get that I ask you, like I come back to you, like this is where I need help, like the body tension in children because mashallah you did the whole cranial and the whole like body working and everything. I feel it is something very underestimated, specifically with what you just said, the stressors in life. I think it's not just like we look at ourselves like as women, we don't realize that what you said, the baby's bodies are also carrying the tightness and everything. So this holistic approach, what is the things or possibly things that what they can look like, what parents can look out for, and what should their care team, if they are facing something and we notice, okay, it's much more beyond the latch. I mean, the latch is good. Physically, we can't see anything. What else would you assess from in your field of work?
Yes. Okay. So when I okay, so when we look at or we're like assessing, or we're looking, or a mom's comes and she's not sure about the latch. The latch is not a breast and a baby's face. Okay? It's not. It's the mom's body, the mom's delivery.
Right.
Then we come to the baby's body, the baby's oral like anatomy, or the oral behavior. And how are they two together? Okay? So please don't send me a picture on my direct Instagram like, what do you think of this? I cannot. It's not about how it looks. It's not. It's like, what do you think? Oh my God, that just drives me crazy. And like, I'm sorry, I'm gonna pause. Just the other day, someone texted me, like, I do have a very, very, very simple question. And I don't answer questions like this on WhatsApp, because unless I know the mom and I know the history, okay? So someone I know and I met, like, I can answer some question. But like someone I don't know, a stranger, I'm like, I just have a very, very simple question about breastfeeding. And I was like, yes, sure. And it was like, yes. So this is that's how it looks like, but I don't think that actually feels right. And then suddenly they rejected the breastfeeding, and then I think my milk drops, and like, oh my God, no, pause. This is not a simple question at all. Even if we keep it down just to the latch, I cannot tell you the latch is okay or not just from a picture. It's like how they're behaving. So if the mom's body tense, that will reflect on everything that's coming. 1, 2, her like posture, position, feeling, everything that happens in the delivery, bringing it to the breastfeeding session. That's okay. The baby, the breast shape. How is the breast shaping? We are having more and more of development issue and cosmetic issue.
Oh,
The
yes.
number of moms who are doing surgery not knowing that it can affect the milk production is increasing, and cosmetic people making it sound that it's okay, it's fine, it's not going to affect. That's a huge issue. It does affect, and the reason you're doing it can actually affect. That's another topic, but let's come to the baby. When the baby comes in holding all the stress, coming to the mom's breast, trying to feed, it's hard. I mean, just look at yourself. I'm bringing you a beautiful glass of amazing chilled water in a very hot weather, and you want to drink it. Can you drink it if you're tied from head to toe and you need to do all the movement to drink the glass of water? Can you drink that water if your head is tilted down? Can you drink that water if something is hurting you to the side? Can you drink that water if you're scared or you're terrified or you're not feeling okay because of whatever, or like, because you've been in your amazing mom's body for I don't know how long, and suddenly you're out there and like, what is this? There's so many things that are happening out there. Now you want me to drink? Well, I don't feel okay. And when the mom brings unsettled baby closer to her breast and the baby does a latch, it's easier to blame everything else but the baby's feeling. Oh, my breast is not okay. My breast doesn't have milk. The baby doesn't want me, or the baby's, I don't know, nipple confusion. That's a big one now. Or, no, it just maybe the baby needs to pause a little bit. You both need to take a break. You both need to just move a little bit and like
Yeah. Wow. I mean,
take a breath and
I
try again.
I love this analogy. I love this example that you just gave about like a baby tied up warqanab and trying to, give that breast milk and put that. Yeah, but I've seen it. I've seen it so many times. I see it every day now. And I feel sorry for the child. I feel we need to shift the perspective, right? We often look at the person talking to us, which is the mother. And I say that to moms even for birth. Like I tell them, advocate for your baby. The baby does not have a voice. Similarly here, I feel this little baby cannot speak up and tell that, hey, I'm suffering, something's off, right? And we tend to put our attention to the mother more, but we need to assess a picture. So now I want to ask you, Miriam, uh, I am walking into the room with you. First of all, you guys should see Miriam's room, like where she does the consultations. Mashallah. I just love the way she
Aw.
removes all the barriers, like Mako barrier. She's the way she assesses the baby. She opens them up and she's just talking to them. She's like I just love observing the way Miriam consults because she just holds the baby and she can
Thank you.
right? So she can, yeah, she actually holds the baby and she can sense the tension in a baby's child. When she's talking to the baby, she's like, I learned this from you, honestly. And that just be a friend to the baby. The baby needed a friend, which it didn't have. It had a stressful mother instead.
Oh,
So subhanAllah, I feel like that. So I walk in with you with a baby. I'm feeling that there is something wrong. What is Miriam going to do? What's the first thing you're going to do?
I want to hear you.
Yes.
You tell me. You tell me what do you want. And honestly, I know I am a breastfeeding consultant and I love breastfeeding. I advocate for breastfeeding, but I want to do what you want. No judgment is there. And I really think we need to change our perspective of this.
So much.
It's not about us. It's about what the mom wants. And it's not wrong. It is absolutely not wrong. And it's nobody's business but the mom and the baby and the family. So that's my goal is like I want to hear you. I want to reach with you where you want to be. And I think we need this kindness. We need this support between each other more than us being a professional, but like being in everybody's life as like lean on me, let me help you do what you want. Nobody knows better than anybody. Nobody. We're in there, we're like battling this thing together. We want to reach there. Let me help you reach where you want to be. That's totally okay. There is nothing wrong with that.
Thank you for saying.
Even though, yeah, I think we need this more and more, honestly. We don't want to turn into like policemen. We don't want to turn into like judgmental, nasty people telling everyone what we know and like guilting them for not following what we think is right. Because what is right is what you as a mom think is right. And honestly, there is flexibility in things, whether we want to believe it or not. And life is forgiving.
Thank you.
We try our best, but the best thing ever is what makes your life better.
Love it.
I do really, really, really think we need this more in our life, in all aspects of our life. That's okay. I mean, life is hard enough. Please, life is so hard everywhere. Let's just be easy on ourselves, on our like people around us.
I think that's the goal.
And yeah, and like do what you think is right. I mean, I had a mom the other day, and she came from seeing all those things on social media. And she was honestly, I'm sorry to say this word, she was performing the latch, okay? Thinking like, this is how, like, oh my God, the amount of stress she's trying to do while like doing the latch. And God, how many times does a mom latch a baby during the day? It's not a one-time thing. I wish. It's not. It's like it's constantly there, like half of the day, if not more, you're trying to latch your baby. I'm like, okay, you know what? I asked her to pause. and like, can you just do it the way you want to do it? And she did it. If it wasn't a breastfeeding book, it will kick all the wrong boxes. But she was okay. The baby was okay. There were she was mentally fine, and the baby was happy drinking. And like, then don't care about anybody else. Just do what you think is okay. Silence that tiny voice in your head which is telling you, oh my God, you're doing it wrong. Oh my God, you're doing no, you're not doing it wrong. You're doing it your way. And if that works for you, that works for you. Khalas. It's nobody's business, you know?
True. So true. I think I saw one like you
So
just
I really think we need to take off, yes, we need to take breastfeeding from being a school or like principle or like being steps. This is how we need to do it into personalizing thing, you know? This is do it your way and let's help you if you have a challenge. I feel we need to make it more of a normal thing
yeah.
than an issue that need to be, intervened with every step of the way. And I think we need to hold and touch our baby more. We need to just the tension in the baby. Like whenever the mom comes with me and I feel there's tense in the mom and the baby, I mean, it's just like the simplest movement that you can think of. Just do it. There is no right and wrong. However you think you want to move your baby, move him. And I know massage is a big in your culture, Hafsa, and that's beautiful. I mean, we embrace the culture, we enrich it, we want it. So wherever you want to move your baby, or like you don't need a professional to do it. Just rub your hand a little bit and just move things around. Move the tummy, move the back, move the legs, move the hands, just the head left and right, the cheek, the fishy face. All of those gentle movements will make the baby feel okay, will make you feel okay. You'll have this amazing bonding between you and baby, and will help loosen up whatever tenses there.
Right. So true. And I think this is the what you just explained and the beautifully described is this is what holistic approach is all about. And this is what we want to implement. And this is what we want to do. Now, before we kind of start wrapping things up, but when there are like, if there, we do notice like tensions and where the ties do need release, I feel there is a lot that here, just simple tips that people think, okay, a snip, khalas. La. I think there is more. There is pre and post as well. I think that needs more awareness. So if you can shed light on that, and then the care. So it's okay, yeah, it's the lactation professional, the person who's doing it, the parents, but sometimes there's more to the care team. So if you can just talk about when we do have to intervene, when we've assessed, we feel like it could make a difference, but then we just don't stop there, right? I feel if we just stop there, it can actually, maybe the release was traumatic for the baby. Maybe it was not what should have been, or the post-care wasn't done right, or the pre-care wasn't done right, and it didn't end up giving the results that they were expecting, right? So I think that kind of awareness on that is important. So if you can just shed light on that aspect and the importance of it as well.
Okay. So, and again, you will see a lot of studies saying that the release was not a success. Okay. And a lot of those studies are used by professionals to support the fact that you don't really actually need to release the tie. Which brings us to your point. So just to make things super simple, when there is a tie in the baby, assessed by a professional who knows about ties, and ties can be 4 level. Let's say one which is the posterior tie, which is all the way in the back of the tongue. Then there's 2, 3, 4 to the tip of the tongue. That's one of the diagnosis tools. It's there, the level of it, but again, then we assess the function. So how is the baby sucking? How is the baby emptying? How is the baby moving his jaw, moving his cheek, his upper lip, his lower lip? What are the marks in the baby's face when feeding? How is the baby's body reacting when is latched on the mom. For example, he's latching, but the whole time you see the baby's leg is kicking, is kicking, is kicking. Or, for example, arching so hard. Or, for example, curling in so hard. So you check the baby's and body's movement. How is the baby like interacting with the mom? Or, for example, when I put the baby flat on the floor, is the baby giving me the banana shape? Or is the baby giving me the airplane shape where he's resting on his tummy and like just stretching his hand and his leg up? Or the baby hates it when we put it on its tummy, or when the baby's lying down on his back, you can see the baby tightly tucked in that he cannot even lift his head up. So all those of things that we look on with the time, looking at the baby. Then we go back to the mom. If everything looks perfect and the mom is having a pain, then that's a red flag. There is something's not working right. We definitely need to help the mom. Or poor mom thinking that that's okay. I will put on with the pain just for my baby's sake. You're not, because the baby is compensating. The baby is trying to overcome something or doing something wrong just to get the milk, but it's not the right way. So if you're thinking you're doing your baby a favor, you're not. You're not putting on with the pain. Baby's getting milk, but he's getting it the wrong way. So something is not working right. And the other thing is when we don't have the vital marks or the vital signs of the baby right, like the birth weight, the weight of the baby and the passing of stool. Those two things are very vital. So when the baby is fine, he's not gaining weight, or the baby's not passing stool regularly. And there's a whole aspect about this. Or when the baby's showing terrible signs of like sensitivity, for example, gases or like body itches or like, um, uh, tense that's hard to move or like needs very long time to burp. And when it burps, it sounds like an old man. So, a lot of, GI symptoms. So we get all of those things together. There is probably a physical sign, like by diagnosis. There is signs on the baby that showing me functioning is not well, and the mom is showing a sign. 2 or 3 will do. One of the 3 maybe will do. Depends on what is happening in the situation. So now we confirm, or we're suspecting that there is a tie we need to work. Snipping it would not solve the problem. Okay, it's like I'm taking you, I'm pushing you into marathon, and you never exercise in your life. Or I'll drop you in a pool and you don't know how to swim. This is exactly what happens when you snip the tie without preparing the body for it. So it's muscles, it's tissue, it's like a whole body. So I prepare the body for the tie. I loosen up the tissue. I open up the mouth. I work up the tongue. I work up the lip, the cheeks, work up the body. Help the mom introduce those movements for the baby. So when it's decided that we need to snip or open the tie, we continue with those because movement before, we release it. Now, okay, let's keep working so we can retrain the body onto doing it right. A lot of times the right position on the breast can do it, but there's no harm. It's actually much beneficial when we reintroduce the exercises with the movement of the body around the baby. Which brings us to a very important point. If you came across a professional, with all respect to everyone, especially dentists, when they tell you, oh, you have a tie, come, I'll snip it. That's all what you need. That is a red flag. There is much more into the tie than just snipping it.
Oh gosh.
The right answer will be see a professional or do some of them knows and they will give you the exercises before and after. It's not about the snip. It's about the before and after and how to do it right.
Thank you so much. I feel, and I love the examples you gave, especially the marathon one. It's like, I could relate to it. I'm not physically fit. If someone tells me, Yalla Rohi, run a marathon, I probably
Yes. It's hard. And it's like the body, the babies are so smart. Their brain is so smart. And if they're used to a tied hand for 9 months in their mom's womb and then coming out for a month or two or even a couple of weeks, and you snip it, the minute you snip it, they will move, but then they will go back to what they're used to, or they think it's the right way to do. Or it's like this is how their brain is signal. This is how I want to do it. But like we with training, we tell them, oh, you can move it more, or this is how you need to do it more.
This is it. The whole point of bringing back to what we started with. It's like we need to see the function, and then we see how has the function changed. Because just like we see issues when there is tightness, at the same time, I have seen like horror stories after releases and even more messed up than how it was before.
Absolutely. Absolutely. The release is a tiny part, even I may say, of the whole tie situation, of the whole equation of like having the right relationship between the mom and the baby if there is a tie issue.
Thank you so much. I really feel this is, I can't, like, I would want to take this part of today's session and just put it on repeat play, like put it up every week, but عشان people realize that there is so much
Absolutely
into it. And just for the sake of awareness, I mean, this is why, alhamdulillah, I'm so glad, first of all, that you're here with me today. And we are shedding light on this because I feel this is something that these points are not even said, like they should be shouted off, but off rooftops, but they aren't, right? And we don't have enough professionals to address this the correct way as well, frankly speaking. Okay, I mean, if I didn't have you, I feel I would be doing so many things so differently and incorrectly, صراحة. I mean, I've done them like not with the right approach and guidelines that parents need. Because like you said, just like we say about the birth, that there needs to be a birth team. It's not just you and doctor, there needs to be a team supporting it. Similarly, I feel there should be a baby's care team like you talk about as well, right?
Absolutely. Absolutely.
This and alhamdulillah for like I wish we could clone you and duplicate you and have you in...
Oh, you're so sweet. We just need amazing moms like you and the moms who know what they want, or like advocate what they want. That's all what we need. It's not about us. It's about like believing that it's their story and they want to write it with the beautiful ending that they see fit.
بالضبط. That is so important. And I love the little stories that you shared. And I'm trying, like Maryam has already told me, like she wants to come with me and she wants to do the training we do in Pakistan as well.
Oh my God, I would love to, inshallah, one day, inshallah.
Yes, let's hope.
Yeah.
Get to Pakistan this year myself, inshallah, when things are better,
Inshallah.
So just this
absolutely.
I don't want to take too much of your time, and I'm really thankful that you're here. Thank you for stating all the points that you said, the red flags you stated, and everything. So anything, I mean, and the beautiful messages you've given to families out there. I do want to like give 5 minutes for anyone who has any specific questions. So if you have any questions, you guys can start typing the questions on the screen. This is Maryam's account if you want to follow her. But yeah, she does not do online consultations. You're not going to be sending a picture to her online and expecting her to tell you if this is her entire release.
I want, if you really, I do reply to my direct messages. If you have like a specific question, I will be happy to answer it. But like, again, I cannot diagnose from a picture. This is not how it works, It's much more than this. But I do appreciate a concerned mom who have a question or like who wants to know more, who like appreciate that there is someone I can rely on. I mean, that's why we were here. We're not dismissing questions just for the sake of it, but like, we want to give it more, and we want to appreciate every story by itself. And yeah, there's a question. I believe this is for you, Hafsa. My point of view is different than yours in this, right? Does nutritional deficiency affect breastfeeding?
I would say mine would be a yes or no answer. I would say definitely yes, right?
Yeah.
I think Maryam, you're rubbing off me now.
Okay, so I can't do yes or no question. My question is, what is the alternative? What are you gonna do? Because you're not eating well. You're gonna give your baby formula? Why are you asking this question? Is it because you think you're not eating well and you want to give your baby better milk? There's nothing better than yours, even if it's just you think it's water. You're the best thing ever that happens for the baby. Is it because you are not taking enough, or you can't have enough, or you're dieting? Oh my God, please tell me you're not dieting. So different food category does come into your baby's milk. If you eat better, if you have better fat, if you have different type of proteins, different type of fats, like I don't know, minerals. So variety can affect what comes into your milk. So if you eat better, your baby's gonna have different, probably better quality of milk. Does that mean if you're not eating well, your baby's not getting any? No, it doesn't work this way. Your baby will get the best thing ever. Immunity can only come from your milk, and there's nothing beat immunity. So no matter how you're eating, your milk is better.
Thank you.
Don't doubt yourself.
Yes, definitely.
Mention based on birth experience, do you think taking epidural would affect that? Okay. I don't see Hafsa and eye to eye on this. It can affect, it doesn't mean everyone's experience is different. So the way it can affect, and I know that now, I do believe hospitals are getting better about this. They do understand that the baby's having epidural, so they can give like, some kind of, buffer hours before introducing formula. Not all of them, some of them. So the baby get dizzy, it will be harder for the baby to latch. When it's harder for the baby to latch, they worried that the baby's glucose will drop down. When the baby's glucose drop down, will go into all those, serious intervention that is not needed. Two things. You can still give your baby pumped milk or like, expressed milk. The sunnah of rubbing dates on baby's mouth is amazing, subhanallah. So I can totally encourage you to do this when you have your baby. And when you're delivering your baby and you have all this planned and you decided not to go with epidural and something happened and you felt that you lost it and you end up having epidural, it's not the end of the world. Keep trying feeding your baby. That's absolutely okay. Okay. You actually can wake up more than what is recommended. They will tell you we'll wait 4 to 6 hours. You can wait more if the baby's glucose is fine. So you can just simply ask to check the baby's glucose. If it's fine, you can wait. No worries, whatever. Okay. And 2 drops of milk will save the baby. That's all it's need. Doesn't have to be 60 ml or 30 ml, whatever number they're like forcing us to do.
Reminds me of that specific. We're panicking. I'm like, Maryam, there's a baby who wasn't drank for this, and baby was perfectly fine. Like I said, I learned so much. Like these experiences just change it for us, subhanallah.
Oh, that's a very good question. Let me answer. Do you mind if I take this question? What could be the possible reason for a baby rejecting breast after release? The pre and post release exercises were done. Okay. So it depends on the release. What did they use? Was it scissor? Was it laser? Was it diode? Was it the water laser? I forgot what's wet jet or what's called, whatever. So there's different kind. The diode, which is very popular, is nasty. It's terrible. It burns the tissue. It's painful. So if you will ask me, would I do a scissor or diode? I would go with the scissor, definitely.
Yeah.
If it's CO2 laser or diode, it's CO2 laser with a smile. So it depends. What did the baby use? What did the tool of the release? 2. The exercises has nothing to do with accepting or rejecting the breast. The rejecting of the breast is a different set of like steps, has nothing to do with the exercises. The exercises is the movement of the tongue. The acceptance of the breast is like a totally different thing. So if we're talking professionally, it's better to solve all the problems before going into the release. So if we're not sure if the baby's accepting the breast, or we're having a weight issue, or we're having like, I don't know, any type of issues, it's better to tackle those, or like, have a plan for those before going into the release, because we don't know how exactly the baby will react for the release. I don't know which point is this. the day of the release, we can expect the baby to fuss around. We can expect the baby to like accept, not accept, want, not want. That's totally fine. Not forcing it is the trick. Just like offer, have a shower with your baby, gentle movements, going up and down, not pushing the exercises that day, which all can help. And it's from my experience, depending on the tool, usually it's just a 1 day thing. Tomorrow, everything will be fine. The trick is if you're so worried about the baby and you introduce bottle, that could be really hard. So my recommendation is to go breastfeeding as much as you can. If you're not sure if you can offer an alternative, do this. But if like you're panicking and you think your baby's so hungry, of course you can introduce the bottle, but it's going to be a little bit longer process after on how to get him back to the breast. So going back to the breast could relate it to the tie, not necessarily. Okay.
Yeah. SubhanAllah. Right. So very important. She said it was the laser, by the way. But you said
So there's like 6 types of laser. Some of them are like so terrible, honestly. And some of them are amazing. So it depends on what type of laser.
you told me that. We had
Yeah.
of course. I mean, that's the same thing. Like the baby can't tell you exactly what it's feeling. So we need to just give it the
Yeah.
Imagine yourself, like if you were in pain or if you had an injury or a procedure, would you be normal? Would you be acting as normal, right?
Yeah.
Take
And
that.
honestly, at this point, I highly recommend the homeopath. And of course, Hafsa, you can talk about this forever.
Yeah, of
Like
course.
arnica is amazing after this. So let's support and help the baby overcoming this, Homeopath is so nice, it's so gentle and like
Yeah,
really is what's needed at this time.
right. I think the care team, you can add on to it. So, of course, the mom and the baby, like the parents and the baby, a lactation professional, the professional who does the release, homeopath,
Body
osteopath,
work.
body work,
Yes, which is the body work. Yes,
body
of
work,
course.
all of this. It's like it's the care team, right? So
Absolutely.
to be all together, mashallah. And we've seen like when one thing didn't work out, trying the other thing did work out. Alhamdulillah.
Absolutely.
Yeah,
Yeah, absolutely.
definitely. And if there was nipple confusion beforehand, like Maryam said, try to address that before going into this, because then we are kind of still struggling with the old issue and then we've added on something.
Yeah, because if you think the releasing of the tie is the answer, it's not. It's not. I mean, I wish it was, but it's not the answer to every problem. I wish it's not. It just, yeah. It may, like, I hate this for real, but it may solve the problem. Whatever problem you have, whatever problem you're struggling with, if we address the tie and we think there is a tie, there's always a possibility that things will not be resolved after. There is a possibility. So we have to be realistic about it. It could help. So many times it does help when we address the tie, but not necessarily.
Yeah, yeah. I would. There's one that says that some nutritionist did customized dieting, which he did, and it later affected the baby's teeth, right? So dieting,
Oh,
yeah, dieting during breastfeeding isn't recommended. No, I would not
oh
deprive.
my God. Oh my God. Please, if anything, please eat more. Don't worry about your weight. Weight is a number, please. And we're in a culture who like idealize whatever. No, every woman is beautiful. Every woman is beautiful. Everyone is herself. Eat right, eat well, enjoy. They grow up so fast. Oh my God, they grow up so fast. You have no idea. So please, enough stress from the world. Just enjoy the moment with them.
I mean, Maryam and I, we both had our last babies together, and now we're like, oh wait, where did the time go between like
Right?
the baby is born, COVID, ما أدري شنو, war, وخلاص, they're big.
Yeah, you are so right. You are so right.
SubhanAllah, it's like, where did the time go?
Yeah,
God,
absolutely.
just hold them closer, more skin to skin, spend that quality time. Before you know it, they want to run away, they want to crawl away, they want to walk away, they don't want to be
Of
held.
course.
SubhanAllah.
Absolutely.
What about neck muscle tension? If it doesn't resolve, doesn't get better, will the Thai release help or not?
May help. May help, and you need a very good body worker, by the way. Those two things. So a good body work, and yeah, definitely. Then, so usually when the neck it's puckle, it's more than the tongue. Usually, not necessarily. So you need someone who like addresses the thighs very well, and it could help. It does.
Yeah.
Again, it's not one answer for all of them. Yes, it may help.
Yep. All right. I'm not going to hold Miriam on for too long. Like I said, these are topics and these are questions which I feel would just go on and on and on.
Absolutely.
We should get on again. I mean, there's just something you just mentioned now, and I feel like, you know what? I want Miriam again. I want to talk about this topic with Miriam.
I was all pleasure. I feel like I'm between my sisters and my friend. Of course, I would love to.
Okay, well, I love it. And yeah, I think it's just such a blessing to have you. And before I just wrap up, I just want to, all the ones that are here for the first time, I am offering online birth classes like we just talked about in today's session. Your birth experience does have an impact on not just the breastfeeding journey, it can have an impact on your relationship with your child, it can have an impact on their milestones and so much more, right? So it starts even before they come into this world. So please prepare for it. The next group classes are starting in English on August 11th, which is next week. So I still have 2 spots left. So if you want to sign up, you know where to find me. Reach out. I'll be happy to do it. And on the occasion of World Breastfeeding Week, I have my favorite Breastfeeding the Right Start. And I'm going to tell you all the things you need to know and between the lines as much as more. Like I say, I learned from these best people and I start changing and I start evolving and adding more. And alhamdulillah, I am on my journey to become an IBCLC, inshallah. And I have started getting my in-person clinical hours almost halfway there. And that has been such a it's been such a transformative journey itself. I just feel like when you were there, when you're holding micro preemies and real babies and just doing it in person just makes such a big difference. So I've got lots of nuggets to share. And then I have a pumping workshop coming at the end of the month because I know everyone's going back to work, inshallah, going back to school, inshallah. And so I have that coming up. So both of these, I decided to put them on in this World Breastfeeding Week, and especially the pumping. There is so much more new information. Again, thanks to Miriam for guiding me towards that with this aspect as well, inshallah. All right. And yes, we've done the question and answers already. So this is where you can find Miriam and this is where you can find me. I just want to thank you, Miriam. Mizan Hasanatis.
Can I just answer, Haram? So there's some people who ask me a question. I didn't read all of them. The one who asked about the weight, Habiba, it doesn't hurt to check the growth chart. If you're not sure, check it and let's see where we are. And breastfeeding baby doesn't need to poop every day. It's better. It's absolutely better to poop every day. If he's so okay, there's no symptoms maybe, but in general, pooping every day is a healthy sign of things. I'm sorry, just Haram. Some people ask, I don't want to ignore it. It was so pleasure, Hafsa. Thank you so much for having me, and always a blessing. Thanks a lot.
يعطيك العافية and jazakumullah khair everyone who's been, and thank you everyone who stuck till the end. Mashallah, I feel like we had a great attendance that benefited, and we had a healthcare we had professionals as well, like Fakia and all those amazing people who are working with moms. So thank you for sharing your golden nuggets. I feel like it's just going to help all of us be better with the moms and work that we are all doing. And thank you for being in my life, honestly, Miriam. That's what I have to say to you. Love you. يعطيك العافية.
Same. مع السلامة.
يعطيكم العافية. جزاكم الله خيرا. And I'll see you at our next talk. Let's see what it is next month, inshallah. السلام عليكم ورحمة الله وبركاته.